Hey everybody, it's me again, Sam. I would like to talk to you today about how to write a character with some mental illness or some health issues, and how you can kind of do it without making a caricature of the illness, making it real, I guess it would be a way to put it. I myself suffer from a couple of things. I have arthritis, I have anxiety, I have depression. It's not all that much, but to me it can be detrimental at times. I also suffer from migraines. Each person is different. Each of these diseases, each of these illnesses, each of these issues with someone's health has a unique way of reacting to that person's body, that person's mentality. When you're writing a character, did they know about this disease or issue beforehand? Have they learned about it? What resources are available? So right now I'm going to tell you about 9 tips on how to write a character with a health issue. Number 1 is going to be obvious. Do your research. There are a lot of resources out there. What I would do is start with anything that has .gov or .org at the end of the website. They're going to be your best bets on finding some things that are relative to what you're writing. And they're also going to be a little bit more trustworthy than something that is posted on like Facebook or something like that. Now, social media can be beneficial. You can find groups of people who are suffering from the disease or issue that you're writing about, and you can politely ask to interview one of them. Ask them a few questions to help make your character feel more realistic and to flesh them out, make them a little bit more 3D instead of 2D. Be respectful and be nice. And like I said, do your research. There are a lot of medical journals online. There are a lot of medical journals that are printed in libraries too. These can be very beneficial because these are doctors and practitioners. These are experts sharing their knowledge on the disease that they're studying. It can show you what resources and medications and tactics are out there for people to, help them. So keep that in mind as well. Also, do your research based on the time period that you're going for. A lot of diseases back in the day didn't have much help at all, especially mental issues or emotional issues. A lot of people were basically shunned or just shut up in a room and tortured. Figure out what time period you want. Figure out what kind of help your character can get or lack thereof. Number 2, write what you know or what somebody close to you knows. The best way to learn how to write a character is to keep an open mind and intake all the research that you take in, plus interview somebody that has the disease or the issue that you are writing about. And number 3, do not poke fun. These people are real people. They're not a shell. They're not a caricature. They're not something that you can make fun of. Know your disease. Know that your character is going to be seen as a person. They're going to be related to. Diseases and health issues are very delicate subjects to people who have them and people who are surrounded by those that have them. You have to be delicate. That's just what it is right there. Number 4, look for medical magazines and digests, women's health, men's health, magazines like that. They're readily available usually in any grocery store or store, even in libraries, for you to peruse through without having to buy. I know magazines can get a little bit expensive, but this will keep you up to date on certain issues that are current. Most of you know right now is COVID-19. A lot of those, I do believe, are delving into mental issue or mental health during a time of a pandemic, of a crisis. And there's going to be a branching out It's not just the disease itself that affects the body, that affects the mind. It is also dealing with the idea of your life changing that will affect your character, affect the characters around the character that has it. And a lot of these doctors and experts in the magazines or the interviewees in the magazines can often open up about certain aspects of that too. So that'll help you get an inside view. It kind of goes with number 1, do your research kind of thing. And number 5, speak your truth. Everyone's experience with this is going to be different. It's going to be unique. Your character has their own truth with working through or working with the disease or the issue that you have. Number 6, if you're going to create a new disease or issue for your world, you can still do your research, do a little bit of what's been done, I guess, so that you can add certain aspects, make it a little bit more complex, a little bit more real, so that it's relatable. It brings fear to your reader, it brings worry to your reader, it brings sadness. You want your reader to be emotionally involved. Number 7, know where you're at in your world. What time frame are you working with? What resources are available for your character? Is there insurance? Is there hospitals, or is there shamans? Is there a newness to this disease or issue in your world that's not been researched? It's not really been dealt with. People are kind of panicking because it's brand new. Are there spiritual healers? Are there medicinal healers? Or is it magical? Who deals with this disease and who can help your character with this? 8, realize that everyone that has a particular disease or issue has a sub-community. A lot of people, when they get sick, they feel alone, but they're not always alone. There's always groups that they can reach out to. There's groups that they can be a part of, as long as they choose to be and as long as the resources are available. Again, that goes with number 7. You have to figure out what resources are available to your character as to whether or not they will have a community with them to help them through this. Somebody that's been through it before, or somebody that's going through it right beside them. And 9, always give a little hope. Whether you're writing a dark, gory fantasy or something like that, there's always going to be a moment of hope. There's always going to be a breath of hope that you need to kind of breathe into your work so that it makes it real, it makes it more tangible. So yeah, that's pretty much all I got for you on how to write a character with a health issue. I know this was really broad and really short, and I know I might go into some deeper things like in dealing with anxiety and depression later on in videos. It just really depends on how I feel about talking about it. But yeah, I just wanted to give kind of a umbrella over writing a character with a certain disease or sickness or something that affects them negatively. It doesn't necessarily have to be negatively. There's a lot of books and shows and, well, superpower and mutants. A lot of those issues have positive effects. Always keep in mind what positive effects and what negative effects will happen to your character and the characters around them in order to flesh out your book to make it more real. You can have a lot of different interactions with this type of writing. You can have interactions with doctors, with nurses, with shamans, with other people who have this disease. You have a lot of meet cutes that you can do, or first meetings. The sky is kind of the limit with this. I should say the disease is kind of the limit with this, because you also got to think about your character's mobility. Are they, you know, shut in to one little area? Are they quarantined and stuff like that? There's a lot of different little things that can affect your character in many different ways. If they are in quarantine, do they break out? Do they cause destruction? Do they cause more people to get the disease? Do they feel bad about it? Do they not? Another thing is, how is it contracted? Is it carried through air, water, skin-to-skin contact, saliva, blood? You know, is it passed down from generation to generation? Therein again is your different interactions. If it's passed down from generation to generation, your character may want to go to the grandmother or grandfather or the aunt or uncle to see how they dealt with it, how they've lived with it for so long. If they don't have anybody, like if the disease is very, I mean, if it kills them early, then, you know, maybe there's a certain time frame that they know that they have, and they have a bucket list that they want to do. I mean, just go with it. Let your imagination roam. But again, just kind of do your research so that your imagination has a foundation to build up on. Anyway, I hoped that this overview kind of helped you out a little. I know I've done a little bit of research myself, and I had a moment where to start with my research. So I have a couple of links below to a couple of websites and an article that helped me out a lot in starting my research on anxiety and depression. So anyway, I hope this helped, and thanks for watching. Be sure to like and subscribe so that you can always get some more information and rambling from me. I hope you have a good day. Keep safe and keep writing.